Hello, everyone. Good evening. My name is Allison Holcomb. I'm the political director at the ACLU of Washington, and it is my great honor to facilitate this conversation we're about to enjoy with three brilliant, passionate, and generous souls about an issue that is near and dear to my heart. I first want to acknowledge that I'm speaking to you tonight from the traditional homelands of the Coast Salish peoples. Our office in downtown Seattle sits on the unceded territory of the Duwamish peoples. Our work throughout Washington spans many indigenous territories, and we acknowledge all First Peoples of our region who have and continue to steward this land since time immemorial. We express our sincere gratitude as guests and thank the original and current stewards of the land. I encourage you to learn about the land you are on. See the link in the chat to find out more. I also want to share a powerful animation on the scale and severity of land loss. Check out the next link in the chat. As we seek to work against white supremacy and settler colonialism, we must always remember the role our country played in the forced removal of lands, cultures, and languages, and recognize the ways in which we perpetuate colonization today. I know you all appreciate that land acknowledgements like this are just starting points for learning we need to do and action we need to take. We need to demonstrate that we understand and are willing to do the work that is necessary to make this country truly fair and just. Before we begin, I have a few quick orders of business. Our Flights and Rights events are typically hosted in breweries and event spaces around the state. Most often, the gathering space of KEXP 90.3 FM in Seattle, or kexp.org, everywhere else in the world. KEXP has been an important partner over the years. Everyone in attendance tonight has been entered in an ACLU of Washington Supreme Swag giveaway. Our prize package includes swag by Indigenous artist Emma Noyes and a set of KEXP and ACLU koozies. We'll draw names after the event and notify 3 lucky winners by email in the coming week. I also want to acknowledge that normally we would have closed captioning available during this event. However, we had some issues with Zoom technology this evening. The recording of this event will include subtitles for those of you who would like to have access to those. If you have any questions at any point, please use the Q&A box. Post-event, we'll send you a list of links and resources we've mentioned throughout the talk. Okay, let's dive right in. We're here this evening to talk about the failures of the so-called war on drugs and the future of drug policy reform here in Washington. We are happy and honored to be joined by some incredible advocates. First, Reverend Jan Bolerjack is a steering committee member of Commit to Change Washington, a campaign working to put Initiative 1922, a Washington State drug decriminalization measure, on the November 2022 ballot. She is a pastor at Riverton Park United Methodist Church, director for Tukwila School Board District 2, and has lived in Tukwila for the past 10 years. She's been in ministry for more than 30 years in the Puget Sound region, and she's known for building community, envisioning and facilitating organizational outcomes, and a unique sense of humor that makes her well suited to developing educational systems that help each person reach their greatest potential. Reverend Jan also serves on the Human Services Advisory Board for the City of Tukwila and as a citizen advisor for the Tukwila Police Department. Welcome, Jan. Next, we have Don Julian Saucier, also on the steering committee for Commit to Change WA. Julian has extensive experience working as a peer recovery specialist with people struggling because of substance use disorders. Julian's own life has been impacted by the current drug policy system, and he has experienced its demonstrated racial inequities. Thank you so much for joining us, Julian. Finally, we're joined by Mark Cook, Mark is policy director of the ACLU of Washington's Campaign for Smart Justice. Mark came to the ACLU as a law student intern before joining our staff in 2008. He worked on drug policy reform for several years and now is developing broader policy strategies to reduce over-incarceration. His interest in drug policy was sparked at the Missouri Institute of Mental Health, where he worked on needle exchange, methamphetamine policy, and rural substance abuse while studying law and social work at Washington University. Okay, let's dive into this. Mark, I'm going to start with you. Can you do us all a favor and define drug policy reform?
Thanks, Allison, and hi, everybody. Just again, Mark Cook, he, him, with ACLU of Washington. Really an honor to be here with my co-panelists and Allison and all of you, and just thank you so much for your support for the ACLU. I'm kind of chuckling at this question for having done this work for quite a long time. I don't think I've ever been asked just what is drug policy reform, but I thought I would just kind of share some broad remarks here. And also just want to say up front that, you know, we're going to have a good conversation tonight, but it's a really tough subject, right? And it's one that I think has impacted every person and every family in one way or the other. And, you know, we often throw around statistics and things like that, but I just want to acknowledge how harmful substance use disorder can be and try to just really remember that sort of human element when we're talking about it. But, you know, drug policy reform to me is that we really just have an utterly failed policy at the national, state, and local level. And, you know, just start with some of the big metrics. You know, they've now come up with the 2021 numbers, and there was well over 100,000 overdose deaths in the United States in 2021 and over 2,000 in Washington state. So that's like 5 a day, right? And, you know, every one of those people was a child or a parent or a sibling. And, you know, we really just should not lose sight of how terrible a job we are doing of supporting people that, you know, may be struggling with substance use disorder. And then I think we compound that by really relying on a system that is utterly unsuited to deal with it, which is law enforcement, right? So instead of trying to take this health issue on directly, we say, well, you're a criminal, so we're going to stigmatize you with that. And then we're going to try to, you know, kind of coerce you into not doing something and not really address whatever the underlying reason was somebody might be using a substance. So drug policy reform to me is trying to end that system, right? So we want to change those laws and try to reinvest in public health alternatives. And then, you know, from the civil liberties perspective, you know, people often ask, why does the ACLU care about, you know, drug policy reform so much? And I think there's a couple points there. So you can make, you know, just sort of the libertarian personal autonomy argument, right? That if somebody wants to use a substance, and the truth is most people use substances and don't, you know, end up having serious harms. People don't like to talk about that, but that's the truth. You know, so there's those arguments. Then there are the really kind of more procedural arguments, right? In terms of drug use is not a crime in the sense where you have sort of somebody that's done something and somebody else doesn't like it, right? So if you break into a home or break into a car, you know, kind of it's a pretty standard scenario, right? Where somebody's going to try to solve that crime. Whereas for drug crimes, you have a person who wants to sell a substance, you have somebody who wants to buy it. So the way law enforcement has dealt with that is to use really invasive tactics, right, to try to get at those activities. So it's confidential informants, right, really invasive search and seizure. You know, in the news, it's things like SWAT teams and no-knock warrants, right? So the way the war on drugs has been waged has really been invasive and harmful. And I would end with that, you know, and this may be the most important part of all, is that it's just been horrifically racist, right, in terms of how it was created and how it has been enforced. And we really shouldn't lose sight of that. If you go back and look at the history of drug prohibition, there's basically always a direct line to racism, right? Whether it's, you know, back in the 1860s in San Francisco with opium, demonizing marijuana coming up from Mexico, or, you know, crack cocaine and African Americans, you know, going back to the 80s. And that is borne out in terms of who has really paid the price for the war on drugs. And for all of those reasons, that's why we really are focused on drug policy reform, and really looking forward to hearing from my co-panelists about some ways that we could be doing things differently.
Thank you so much, Mark. That was a powerful way to frame the issue for us. I think I'd like to turn to you next, Julian, if you don't mind, and just ask you, what is it that brought you to this work?
What brought me to this work is my own experience with substance use that got carried away, but it ended up being put into the legal system in a way that I recognized firsthand, because my co-defendant was not the same color that I am. Got an entirely different result than I did. He got some time at a halfway house. I got was sentenced to 88 months and was sent far away from my family because it was a federal case. The impact on my family was horrific. The time it took from start to finish was well over 10 years, about 10 years. And I didn't like to see those impacts. I thought it was odd, like first time, and you end up getting a sentence, you get sentenced to this time, and I just lost control of I'll say I got control on the substance, but there were times along the way where I was seeking out intervention, but didn't know where to get it, didn't know how to get it, didn't know how to ask for it. And I was ashamed to share that with many people, I was ashamed to ask for it. It's a very traumatic experience. I just don't want to see more people go through it, but I did see a lot of people in prison the same way, first time offenders, a lot of people, their lives disrupted, and disconnections with kids, and disconnections with life, for a point. I hope they're doing well. I was blessed to have a strong family and have a strong support system, and realized later on that I could have really reached out to different people, because I was really surprised by the response and support I get when I talk to people in the door. There's a lot of support for people caring and wanting to help people, and we need to make that into policy, because people don't need to be further shamed and stigmatized and hide basically, and not get the help that's available. And the earliest time we get an intervention, I think the better. So the work, the steering committee and the people here at with ACLU and everything has just been tremendous to watch evolve, and I think it'd be great to start with a good example in Washington to really start caring about people.
Thank you so much, Julian. Reverend Jan, if I could ask you, what do you observe about the war on drugs? How does this issue impact your community, and how are you involved in work that relates to it?
Yeah, thank you. And thank you, Julian and Mark, for putting a face on this, a human face, a face that is loved by their parents, their friends, their community. I moved from serving a church in East King County, a nice place where there was substance disorder use, but it was behind closed doors. We just didn't see it, and we didn't talk about it. And I moved to Tukwila actually 14 years ago, and boy, Tukwila is high crime, high poverty, high everything that makes life really difficult. And my church has historically been known as the place you go when you hit rock bottom. So when you don't have any food, when you don't have any clothing, when you don't have any community, try the Methodists. They might be able to help you out. So I want to tell you a little bit about Mark. Mark came to me early in my time here, and Mark lived on campus for several years, nice guy, rode his bike around Tukwila, was known as the guy on the bike, and he went and helped people in different places and was known as one you could call on to help, whether it was for a mechanical thing or get your own bike fixed or whatever it was. Mark was always there to help, but Mark would disappear for 3 or 4 days at a time. And we knew that that's when he was really, really struggling. He was ashamed to come back. And when he did come back, several times he said, "Do you think you can help me?" And so, yeah, I mean, I dove right in. Let's get him in treatment. Well, of course, when he came back, he didn't have his driver's license and he didn't have any ID because it had been stolen while he was gone. And so we tried to fix that barrier. And then we tried to get into treatment, and he didn't have the right insurance, or he didn't have the financial support. We never got him into treatment after 5 or 6 years of him coming and going from here, being a great guy when he could and totally falling apart when he wasn't. He finally moved into a house with a family that was very much known for using drugs in this family. Mom and dad, grandma, and 5 children. Mark was downstairs in the basement when he took his last hit. And the 12-year-old in the family found Mark with the needle still in his arm. Rigor mortis had set in. They called me at 1 o'clock in the morning. I went over to the home, kept the kids calm upstairs while the investigators in the corner worked downstairs. Where is the services? Where are the resources? The last thing I heard about one of these kids, the 12-year-old that had found Mark, the last thing I heard about him was in the news when he was involved with gangs and a gun at a bus stop. Where was the service to help all of these kids through the trauma that they saw? Where was the service to help Mark so that his life could have been saved? There's just so much missing in our support for folks looking at root causes or giving the support that folks need to be able to change their life when they want to, not in 6 weeks when they can get into a treatment center. So that's why I'm involved. I didn't find out Mark's family situation until after he died, found out that he had a mom who loved him dearly, but couldn't deal with how Mark was acting at times and had to kick him out. So fortunately, he found us for a while and had a stable place, but we never got the services to Mark. And I do this work in honor of Mark.
Thank you so much, Jan, for that painfully moving story. I want to take a beat here for a second and come back to you, actually, Julian, because I think one of the things that we hear a lot around drug policy reform is the argument that many people believe that the current system, the threat of being arrested and prosecuted and put into jail, actually works because in their mind, people with substance use disorders actually have to hit rock bottom. And in this case, they're talking about rock bottom, meaning you've gotten arrested, you're going to get thrown in jail, before they'll actually begin to recover, to access services and recover. And I'd be really interested in your perspectives on that argument.
Yeah, I hear that argument too, and I as I learn more about trauma and how people generally use drugs to cover up to deal with some sort of trauma. They may not know what it is at the time or what they're dealing with, but yeah, it's used often for trauma. I think that the trauma, like substance use and different things that people do, is self-preservation. That they don't realize they're doing that either. It's like your own self-preservation. When I came out of prison, I convinced myself that it saved my life. Because you want to make sure you don't want to say, "Oh, this has been a big waste of your life." And I think naturally you want to make it a good point of it. I think there's a lot better ways for treatment. I think that for me, prison was more traumatic than isolation and drug use. than anything, because it was a place to navigate where, you know, and I didn't do a bad job of navigating it, you know, but in the same spirit, if I didn't have to go to prison, I wouldn't have had the difficulty finding a job. I wouldn't have had to turn away from housing. I wouldn't have had further shame and added. Like you take somebody who's already has a problem and you throw more shame and disengage in the community, then that's not helpful. That's the opposite of helpful. That's downright harmful. And I think that some people believe that they have to hit rock bottom, but the rock bottom doesn't have to be behind a cell where there's not services for somebody to heal. I think people need to be met where they're at and the timing that they're at. But prison, I think, like, honestly, like when I first went into prison, all I could think about was when I get out, like, how am I gonna get drugs, you know? And it, you know, there's a point to where I stopped that thought. But you know, because there's drugs in prison, but you know, there's everything you need in prison, everything people want or desire, you know, is costly. But it's not designed as a place for healing, and healing has to be comfortable, safe, and with people that are equipped to help you navigate recovery.
Thank you. Thank you for that. But pause for just a second to remind everybody that if you have any questions that you would like any of the panelists to address, please feel free to pop them into Q&A, and we will definitely get to those. So I'm going to shift gears just a little bit here and start talking a little bit more about policy before we get to where we are today. Mark, I'm wondering if I can come back to you and ask if you could share a little bit about the history of drug policy reform here in Washington State and the challenges that we're currently facing and doing better.
Happy to. You know, so I want to start a little bit just in terms of how we kind of made the problem worse. So, you know, a lot of people would point to, you know, Nixon's famous speech in the early 70s as, you know, kind of one, quote unquote, the war, public enemy number one, right, is drugs. And that really was sort of a turning point legally, in that it was then the federal government passed what's called Uniform Controlled Substances Act. At the same time, basically all the states adopted it too, or a variation of it, right, which pretty much, you know, outlawed all sorts of drug-related activity, right, and made it a crime if you're possessing these things, or, you know, violating any of these kind of legal requirements, right? And really from then on, you just kind of could see this meteoric rise, really in the 80s and 90s, right, in terms of our primary response to this is we're going to, you know, do things like just say no to drugs, and we are going to arrest people, and we're going to arrest them in a really discriminatory way, right? You know, I'm always struck in these kind of events and hearing from people that, like, it's just so different if you are a wealthy person that, you know, has a home and a stable environment. You know, drugs have been decriminalized for you for a long time, right? If you don't have those privileges and you're in an over-policed neighborhood with a lot of stress and trauma in your life, those are the people that were getting arrested. And in Washington, just like every other state, we're talking about thousands and thousands and thousands of arrests. Up until a couple of years ago, you know, in Washington, there was easily 10,000 low-level drug arrests every year happening in the state of Washington. So that really was the primary response, you know, going back, you know, decades. At the same time, Washington, I think, should have some pride in that we've been trying to push back on that in various ways. I wouldn't say, you know, we have certainly not solved the problem, but there's some really good things that we're trying to build on. So wanted to name a few of those. So in the 80s, when the AIDS epidemic was, you know, in full force, Tacoma, Washington was the first legally sanctioned needle exchange program in the United States. A guy named Dave Purchase was fed up, right, in terms of his community, and just put out a card table and started doing needle exchange, which is one of the most effective, harm reduction programs that you can think of, which was great, and eventually those became more common in the state of Washington, which is good. I think we've also been leaders in the marijuana context. So Washington was one of the first states to pass a medical marijuana law in 1998, following California. And then, that was a similar kind of pathway to eventually fully legalizing adult use marijuana and regulating it and decriminalizing it in 2012 with Initiative 502, right? Which, isn't a perfect law, and there's things to learn from it, but you just look at the data and thousands fewer arrests happen because of that, which, I think is a really good thing, because it was not your average hemp fest smoker in Seattle that was getting in trouble. It was somebody that's pulled over at night and an officer can say, hey, I smell something, I'm not going to search your car, right? And they can't do that anymore, which is a good thing from our perspective. We've also seen some really wonderful diversion type programs, things like the LEAD, Law Enforcement Assisted Diversion, or Let Everyone Advance with Dignity program, which we were very involved with in its adoption, which is kind of a test case for not treating substance use disorder as a crime. And then, more recently in 2021, our state Supreme Court in the Blake case found that our primary drug possession crime was unconstitutional. And beyond that, they actually, technically voided it entirely, which meant that it wasn't just a forward-looking decision, it also looked backwards. So now any person in Washington state that had been convicted via that unconstitutional crime should be entitled to some form of criminal records relief, and hopefully, if they had to pay fines and fees for that case, should be getting reimbursed for that, which was transformational in a lot of ways. Unfortunately, our legislature immediately recriminalized drug possession, albeit in a less punitive way. Used to be a felony, now it's a misdemeanor where you are supposed to get diversion opportunities first, which is good. So it's a mixed bag, I guess, is my answer, in that we still rely on the criminal approach officially with all the stigmatizing and harm that I think it does. But it's also a place where we've been able to move beyond just criminalization and try different things. And I think that's what we are hoping we can go even farther with this year and in years to come.
Thank you. That's a great overview. I'm going to stay with you for one more question. Can you bring us up to the current day and give us an overview of this campaign we've been talking about, Commit to Change Washington and Initiative 1922?
Yes, happy to. And I think there'll be some links in the chat if you would like to learn more. So Commit to Change Washington, as you heard at the beginning, is a coalition of public health experts, treatment professionals, legal and law enforcement experts who have really come together to try to change low-level drug offenses entirely and fundamentally change how Washington State handles those situations. So it would sort of do that in three big buckets. First, it would dedicate $141 million a year to kind of public health responses to people with substance use disorder. And it's really not just that money, it's really designed to try to maximize every resource possible to try to get those services that are so needed. Using things like Medicaid and private insurance, and trying to figure out how much money we spend on law enforcement and capture those savings and put those into services instead. So it's really trying to fund the alternative and set that up. It would decriminalize, the low-level drug offenses that we're talking about. So things like just simple possession, or if you are in possession of drug paraphernalia, things like that. It would also try to, make in the law that law enforcement need to refer a person who may be in possession of a substance to the right type of services. So it, requires things like law enforcement training and trying to really connect people to services statewide. And it also tries to look backwards, right, to make it easier for people to clear criminal records if they have past drug-related convictions on their records, right? Because those harms really can't be understated, right? In terms of the secondary consequences of having a criminal record. So it's really trying to address those. If you really want to get into the nitty gritty of the initiative, we can share those materials. But that's really what it's about. It's to try to decriminalize substance use disorder and heavily invest in public health alternatives.
Thank you, Mark. Julian, what do you think? Is Washington ready for I-1922? And I'm hoping that you're going to say yes, but more importantly, I want to know what makes you in particular excited about this initiative.
Yeah, I know Washington is ready, and I think we're ahead of what Oregon was at the time when they implemented their plan. I believe that there's been services added and a change in our healthcare system with behavioral health and substance use being tied together closely and being provided automatically with insurance now. I believe that the attitudes already started to change a bit because people are recognizing that the sky didn't fall when the Blake decision came down. I believe that yeah, I think we're ready. I hope we are, and I'm a little concerned because there's this this fear of the political climate and stuff like that. But I think that I don't want to be self-fulfilling, and say, oh, no one's going to vote, no one's going to do this. I'd rather just go on full steam because you see, it has a lot of support from both sides, which is really, really important. And we just need to make sure that people really understand what it actually is and what it's not, and what difference it makes. It really just the whole goal, I think. We'll pretend like the drug war was to reduce death, to reduce drug use, to reduce all these different things, all the things it has not done, because they slope up hugely and it has not accomplished anything except wasted a lot of money and harmed a lot of families. So that I'm excited that the services are going to be available, that people know where to get services. It's going to be low barrier, some harm reduction, some tracking, and I'm excited about like the compassion, and hopefully one day the stigma will be gone, and people will care for one another and just understand that people do different things. Something that I found interesting. A friend of mine's trying to quit smoking, so he has this book that kind of reminds you that alcohol is a drug, that cigarettes are a drug, caffeine is a drug, and that and pointed out that actually a bar is kind of a safe site, a harm reduction site, in a way. I'm like, wow, yeah, you're right. It kind of is, because they're not going to overserve you, and make sure you're safe. But just to put things in perspective, as you read more about history and you read more stuff, read more things, you realize that this stuff was coped with before. They used to tax some of these things. Sears Roebuck had drugs in their catalog back in the day, back in the 1900s. That prohibition just creates an uncertain market, so just to be thinking ahead. But if I just focus on what we're doing, I think that it's a great first step, and I really hope that people will shake that shame, especially in the communities that are harmed, which is difficult.
Thank you. And thanks for that reminder about the Sears Roebuck catalog. I forgot about that. And also that comment about bars being harm reduction strategies. That's actually true on a lot of different levels, right? Because bartenders and bar owners run really significant risks if they don't take care of their customers and make sure that they have a cab to get home safely rather than driving, et cetera. So really interesting. I want to hang out with you for just 1 second, Julian, in case you might want to tackle the question that's been posed by Phyllis Hatfield. Phyllis asks, are there any drug programs in Washington prisons and jails I thought you might have some insight into that based on your peer recovery work.
I don't honestly know, to tell you the truth, in Washington. That's a good thing to ask. I know we did have it in federal prison. And but it's more, it's like a carrot stick. Like you take this and you can get out in a year early, you know. So it's but it's a good program, to be honest. But I wish they started with that on the outside. That would have been great. I've been home, been able to spend time with family and stuff. But I like to check into that. That's a good question. That's a great question.
Thanks. Mark, do you have any insights into that?
Yeah, I can't speak to it, you know. So there's a lot of prisons and jails in Washington, you know, there's 57 jails and then, you know, lots of different DOC prisons as well. It's my understanding there are some drug treatment programs at the DOC level, but not everywhere, and probably not everybody that needs it. You know, and sometimes they can be time limited. I will say, like in most jails though, there's nothing, right, in the jail. And one example, we were part of a lawsuit against the Whatcom County Jail, who was, you know, in our opinion, denying people access to medications for opioid use disorder, right? And so, you know, generally what happened is somebody would go in and, you know, if you've been using opioids, you're not feeling well, you go into withdrawals, really dangerous and really, you know, dangerous. And even if a person was taking medication for that, you know, lawfully prescribed medication like buprenorphine or methadone, you would just be cut off. And our case was, you would never do that to a diabetic. You would never do that to somebody with a heart problem that takes medications. But for substance use disorder, that was kind of the plan. And that is sort of slowly changing now. And more places are, you know, allowing that type of service. But I guess the point is that generally no, right? And our society's response was, yeah, we're going to put you in jail and we're not going to give you the right type of care, which is really, really harmful. So those are my thoughts on that.
Thanks so much. And thank you so much, Phyllis, for the question. Want to remind folks that please add more questions to Q&A. Really want to make sure that we're taking the conversation in a direction that you find most helpful and interesting. So thank you. Chan, how about you? What do you want people to know about this initiative, about what's happening in the world right now, about drug policy? What would you like people to take away from this conversation?
I really like the way the conversation in general is going, at least in the circles I'm living and working in, moving toward those two things, harm reduction and that substance use disorder is a public health issue. It is not a criminal issue. It's a public health issue. And part of what we need to do is take all of this apart and figure out what are the root causes. I think even though society doesn't necessarily look like it's moving toward compassion, I think maybe on this issue it could, because if we tap into almost every family has some experience with this. Someone who has been forced out of the family or has been lost to the family. They don't know where they are. They're living on a street someplace. And there's just a lot of grief around what happens to people when they have this disorder. And I think that if we tap into those concerns for people's children or their parents or what, you know, their family members, I think we can come to the place of compassion and want to reduce the harm and give the resources for the treatment to help folks stop dealing with these things that are breaking up so many lives, and look at it as we do look at diabetes or cancer or whatever that is, and get the treatments for folks. I think we can do it. I think we can pull on the heartstrings of humanity and help folks see a better way to deal with this tragic part of our world that touches so many of us.
Thank you for that. Yes, a lot of grief, but a lot of hope and optimism on those heartstrings of humanity, right? Striking that chord has very powerful reverberations across our communities and society if we want it to. I am going to give all three of our panelists this really slow explanation of the final big question I want to put to each of them. It's not a speed round, so you get to take your time in your answers. We have plenty of time. This also cues in all of our participants that if you want to ask that big question of these amazing people, now is the time for you to be formulating that question and popping it into the Q&A for us. So here we go. Here's my final question for each of you. What is your vision? What's your vision for drug policy reform in Washington State? And I want you to be looking out a decade to the year 2032. So in 2032, what would you like Washingtonians to think about and to see around them when it comes to drug policy and how our society responds to it? So, Mark, I think I'm going to kick it off to you first. Are you ready to be in the hot seat?
Sure. I love these questions. So I don't know. I mean, let's try to do it even faster. I think, we have a lot of work to do, but I try to break it down into a few different things. And, this has been mentioned by a few of us, but I think one needs to just be massive public education and destigmatization, right? So people feel more comfortable talking about this stuff, right? So whatever that looks like, it's really incumbent on all of us to have a different perspective about it. So, I'd love to see investment for that. I would second say, I don't think there's one perfect service treatment response. And what we really need is an entire spectrum of services for people who may be in various kind of stages of substance use, and that there's really an entry point to any of them. So if somebody wants to go into an abstinence-based only, 12-step type program, they should be able to do that, right? If somebody wants to get on medication, right, and like buprenorphine for opioids, they should be able to do that without any difficulty. If somebody needs to keep using for a little while, for them, that's fine. Let's keep them safe and let's give them the other supports they need to be stable, whether that's mental health care, physical care, or housing, right? Which is something we haven't talked about, right? If you have tens of thousands of unhoused people, right, we're really not gonna truly be taking care of each other, right? Which has an overlap here. So all of those things I think need to be heavily resourced, and it's really going to just take a lot of money to train the people to provide those services and give them a living wage. We need to do all of that. And then, as we've talked about, we need to stop criminalizing all of this. Not just at the user stage, but I think the time has come for us to talk about things like safe supply, right? We haven't mentioned fentanyl yet, but fentanyl is a very powerful version of an opioid that has taken over in Washington State and now the entire country, and is really the reason for the massive increase in overdose deaths. So I'm not saying that we should, legalize all drugs like we have for marijuana, but I think we can't talk about the war on drugs and just focus on users. So I think the time has come for us to really have an even bigger conversation about the supply issues, right? And we haven't talked about the havoc down in Mexico and the places that supply the incredible demand in the United States. So that's a tall order, but frankly, I think that's the pathway we are on.
I gave you 10 years, so that's not too tall order. I think we can get to all that in maybe 6. Does that sound appropriate? Julian, what do you think? What's your 10-year vision for us?
I agree a lot with what Mark said. I'd like to see a space where honestly people can be more honest, like in education about drugs and stuff like that. I think the past, when they just said like drugs are bad, and then you go to a house and everyone looks like they're having a great time, it's kind of tricky. You're like, no one's dropping dead. No one's. You get all these mixed messages, and you don't trust. The messengers sometimes after people tell you different things. You need to be honest on the impact, be honest the families too, like encompassing like the family knowing that the behavior your son is not aimed at you. He's responding to how he's trying to, like, to get a better understanding, so people understand and can communicate with people on a level instead of the battle going and things being kind of personal. I'd like to see like a different like mega different entry points for services where you can meet people where they're at. Some people want to get stuff earlier. Some people don't recognize it until later in the program, and just a place with compassion where the example that Washington sets is spread across the country. I like to see a nationwide model as well, like that's more compassionate and away from the criminalization of drugs, because we are wasting a lot of money and hurting a lot of people.
Thank you. I love that idea of making Washington an example, a domino to help expand options and opportunities across the country. How about you, Reverend Jan? What do you think?
Well, I agree with what everyone has said. The stigma, I think, is just still very alive, and we need to get rid of that. We need to get people to be able to share this illness so that we can figure out how to best help. And that the best help really comes in the way that each one determines, like you've said, a variety of access points. I also want to see more of a pathway for success. I know that a lot of my folks that come here with a substance use disorder and are criminalized, put in jail, get out of jail, come back, there is no pathway for success. There is no supports to help them to get that job, to get that driver's license, to get those things. They're just kind of put back in the same position. And I would like to see more assistance to see people succeed. I think one of you said something about looking out for one another. One of the things that I learned during the pandemic was that the bathroom here at the church became the only public bathroom in Tukwila. McDonald's shut their bathroom, community center shut their bathroom. It was our bathroom, and it was used for a variety of reasons. And it got to where I was looking out for people who were using our bathroom, even though they may have been using our bathroom for things that I didn't actually agree with. I thought, well, at least you're choosing a safe place because someone's looking out for you. And yeah, they weren't ready to receive services. Maybe I offered it several times, but at least it was a safe place and we were watching. And it brought me to a new level of understanding. I can sit in judgment and say, I don't know why people choose to do, why do people choose to be overweight? That's me. And I can sit in judgment of that and think, well, why don't you just eat less? None of it is that simple. It's not that simple to choose between drugs and no drugs, or homeless and no homeless, or job and no job. There's just a difference in the choices that each one of us has and how we see access. And so for me, a big part of it is understanding, of learning. Like Mark said, the educational piece, I think is essential as a society to understand what's going on, more than just seeing it from our own personal lenses, but see it from the perspective of the person that's dealing with this health crisis.
Thank you. We're going to wrap it up, folks. So please feel free to pop any questions into the Q&A. In the meantime, I have a couple of outgoing comments for the good of the order. If you are interested in Commit to Change Washington, the campaign to qualify Initiative 1922 for the November 2022 ballot, you've seen a link about the campaign generally. There is a specific page that you can go to volunteer to be involved with the campaign. And there are many different ways in which you can volunteer. We need people to help us scout locations across the state for events, for signature gathering. We need people to help us monitor stories that are appearing in the news that we could like or dislike or weigh in the comments, etc. We need people who are willing to lick envelopes and lick stamps. There's all kinds of different things that you can do to support this statewide effort. And tomorrow, there's a very specific opportunity. If you think you might be interested in volunteering to help us gather signatures on the petitions to qualify the measure, you can attend a volunteer signature gathering training that's happening tomorrow evening, Wednesday, April 27th at 7 p.m. There's a link in the chat for both of these options to go and volunteer generally and to participate in tomorrow's training. Volunteer signature gatherers come in two different forms. There are those of us who are willing and comfortable to gather signatures from our friends and our families, people that we know, our own social networks. And then there are those of us who are extroverts and love to be out in the public, talking to folks about issues that we really care about. And there is a training for those people who are willing to be public signature gatherers, to go to your farmers markets, to go collect signatures on the ferry, etc. So please, however you might want to engage, do feel free to sign up and join tomorrow evening's training. With that, I'm just going to double check and make sure I haven't missed any questions that might have appeared in Q&A. Nope, looks like we're all good. So I'll just close out by extending my deepest thanks to Reverend Jan, Julian, and Mark. Thank you all so much for sharing your personal experiences and your insights into drug policy and the harms of the current war on drugs approach to people's drug use and substance use disorders. And most importantly, thank all of you, the attendees, who tune in occasionally and regularly for our Flights and Rights programs. We really appreciate all of you. And with that, I'll bid you all a very good evening. Thank you again, and good night.